Hi, I'm Dr. Freeman. I am one of the pharmacists at Southside Discount Pharmacy in Winston-Salem. With me, I have my pharmacy students.
Brady from the Fred Wilson School of Pharmacy at High Point University.
Thanks, Brady. And thank you for joining us today, because today we're diving deep into continuous glucose monitoring, which we'll be calling CGMs. So what exactly are CGMs? Well, first, there's been this hype on how do I check my blood sugar without having to prick my fingers? Or why do I need to keep pricking my fingers? Or it's just getting annoying pricking fingers because it's just painful. And quite honestly, we have these little friends here, and there have been the best things since sliced bread. I don't know. But honestly, I will be talking, we're only gonna discuss the two types of CGMs that are commonly seen in community pharmacies. And please also keep in mind that what we talk about today, it's only geared towards patients with type 2 diabetes or caregivers for caregivers for patients with type 2 diabetes. So what exactly is the Freestyle Libre? Well, Freestyle Libre only comes just like this. It has the reader and it has a pack of one sensor, which you're supposed to wear for 14 days. Now, the sensor should be placed, or it's supposed to be placed at the back of your arm, and it's meant to stay on your arm for 14 days. The Freestyle Libre is a flash CGM, and it's the only one of its kind in the US currently. It does read your blood glucose every 15 minutes. It does not have an alarm system that actually alerts you when the blood glucose is going up or when it's going down, but it does have trending arrows that lets you know if you're trending down or if you're trending up. And this is really good for people, or for someone that has that has the fear of their blood glucose going lower and choose not to use their insulin, because that also is a problem that we do encounter in the pharmacy. Something else that you need to know about this the Freestyle Libre, is that it must be scanned every 8 hours. So if you wear it and you're going to bed, it's best to scan it right before you go to sleep. Or if you feel like you could be sleeping longer than 8 hours, it might be advised to set an alarm to get up at some point to scan it before the 8-hour span is up. Is it a painful implantation for the sensor? No, it's not. It's really painless, and when you do see these things, the little needle is actually not a needle in there. It's like a sensor, and it's very flimsy. It's truly painless. Something else that we do want to let you know about the Freestyle is, between the two, it's more of the affordable one. It costs maybe about $200 a month, roughly. So it's something for someone that does not have insurance and actually do want to consider, or actually do want to check their blood sugar but don't like pricking the finger. We've seen that it's something that they might consider if it works well for the individual. And another thing is also, if you do have insurance plans, like everything else, do have their preferences on which one they prefer. So right now, I will let Brady take over on the Dexcom G6, because that's more in-depth as far as CGM goes. So Brady, please take over.
Thank you, Dr. Freeman, for those insightful points about Freestyle Libre and CGMs together. So now I'm here to talk to you about the Dexcom G6 model, and that is a continuous glucose model as well. The Dexcom G6 is a real-time continuous glucose monitoring device for the management of diabetes in people 2 years of age and older. The Dexcom G6 system is intended to replace fingerstick blood glucose testing for diabetes treatment. The Dexcom G6 system provides continuous glucose readings, which are updated every 5 minutes, providing glucose levels, trends, and alerts. The system consists of 3 main components: a sensor, a Bluetooth transmitter, and a receiver, or a mobile app on your smartphone. You can view your glucose data on the receiver or on the G6 CGM app and can scan as much or as little as you like. The system provides alerts and alarms which warn the user of low or high glucose levels, or if you are trending towards one of these directions. The sensor may be worn in the abdomen for adults, in both the abdomen and upper butt for children 2 to 17 years old. Once you apply the sensor and set up the app, you will not need to calibrate the device again. Many people are often worried about how much one of these devices will hurt. Well, I have good news for you. They hurt less than a typical finger stick. You should contact your doctor to see if this device is right for you. Now, let's talk about cost. One sensor will last 10 days, and 3 sensors come in a box. Prescriptions for these are written as a 30-day supply. The cash price with no insurance is around $350 for the sensors, and this includes a free phone app. This is more expensive than the Freestyle Libre, but Medicare typically covers about 80% of the cost. North Carolina Medicaid currently prefers the Dexcom to the Freestyle Libre. For more information, please contact your insurance company by calling the number on your insurance card. It's usually on the back of your card. And Dexcom sent us a demo model of the G6, so we will show you how easy it is to use on our wonderful volunteer, Scotty.
All right, Brady, before we show this demo, so can we just tie up
Yes, absolutely.
everything? Well, now that we know a little, at least, a basic information on the CGMs, the Libre, Freestyle Libre, and the Dexcom G6, can we talk about the pros and the cons when it's compared to just the regular meter?
Yes, absolutely.
Okay, well, for the pros, what would be one of the pros that you can think about? Why would someone want to do this over the meters?
Why would someone want to do it? Well, it's a lot easier. It's a lot faster.
I would have to agree. Yes, it's easier. It's more engaging for the patient.
Yes.
It does check the blood glucose, but one thing we have to make sure that the patients understand is it will not be accurate as far as checking the blood glucose with the scans. When you compare it to the meter, when you do a finger stick, there is a small difference because there is a lag time for when the blood glucose actually reaches your blood, or when the glucose actually reaches your blood. Basically, what I'm trying to tell you is the finger stick gets you the real current time as far as where your blood sugar is at the moment. These scans are not exactly where you are, and that's why they both have a trending error telling you where you're headed. What it checks is the blood glucose, or the glucose that it actually does check is the amount of glucose in the fluid between your cells. So it's not the blood, not the glucose in your blood compared to the monitor in the capillary blood. In the capillary blood. The best thing about this is that you can always scan it whenever, wherever. It's very convenient, very easy, painless, pain-free, and you can share the data with your caregivers or even your doctor for easier management of your diabetes. Now, sometimes because of the alarm system, especially with the G6, the Freestyle does not have an alarm like I mentioned, but the G6 with the alarm system, it can get a little overwhelming. But it gets to a point where you can make that changes or set the alarm if it becomes too much alarm going off at a time. The con to it, I guess we can also say, it doesn't totally eliminate the finger sticks. Because if you're feeling different, but it's telling you different, again, the lag time, you would need to check your blood sugar using the monitor. So I think that wrapped it up, and I hope it really helps. If there's any question about these things, feel free to reach us. We're here always, 336-830-8774, and we'll show you a demo of the Dexcom G6.
Yes. Now get on out here, Scotty.
Let's do it!
Hi everyone, this is Scotty, our wonderful volunteer that we have today, and we're going to be doing a fake Dexcom demo. This is not the real one, there's no sensor or anything entering his body, but we're going to act like there is. So this is a Dexcom G6. This is what actually inserts the sensor into the body. So what you'll want to do is when you first open this up, you'll see a number here, and you'll want to enter that number into your phone or go on the app that you have. So first things first, we want to clean the site where we're going to actually be putting this at. And we want to go and make sort of like a little donut around it. We don't want to do the very center where this goes in at. So next things next, we're going to peel off the covers, exposing the stickiness. Next, we're going to find our spot. We're going to stick it on there. Now stop. So next, you will click this big orange button, and there we go. Easy as that. That's on them. Now, you'll want to take your transmitter here, and you'll want to clean your transmitter, and then you simply pop it into place. Easy as that. And so this right here, your sticker and your purple, that will be replaced every 10 days. Now, your transmitter here, that will be replaced every 3 months. So you want to make sure you keep a hold of this and you don't throw it away. If you like this video, please make sure to smash the like button and subscribe for more videos like this. Let us know down below in the comment section what topic you would like us to cover next.
Yep, after all, wellness should be fun. See ya.
Bye.